A solution to a crisis, as teenage pregnancy statistics continue to increase to shocking numbers. In 2024, the Free State reported that 108 girls aged between 10 and 14 gave birth, while 5,049 girls aged between 15 and 19 gave birth in the same year. To curb the increase, the Provincial Health Department administered long-term contraceptives on schoolgirls in Bloemfontein. The department believes this contraceptives planning program will decrease the number of young girls who fall pregnant. It hopes that this program will also ensure that girls can remain in school.
So we are here today to make sure that after getting the consent from the parents, the children, that some of them are, vulnerable, they do get the, prevention measures, and those that are already, engaging in sexual activities, they also, you don't deny them, because as parents, you are not with them all the time. As teachers, you can't be guarding the children all the time. So make sure that there are practical measures that will make sure that you keep the scourge by implementing these long-term prevention methods.
A health expert from the department says they obtained consent from parents. She emphasized that children as young as 12 can walk into a clinic and request contraceptives without their parents. But Department of Education policies require that health practitioners obtain consent when working in schools. The department says it's not encouraging young people to be sexually active. However, it's important to be proactive and assist the youth to facilitate their lives.
Because we have the policies that are guiding us when we are in the school. And then we have the policies that are guiding us when we are in the clinics. When we are in the schools, we need to get the consent of a parent. Remember that the parent, they have sent their learners to school for teaching and learning. And then for the health services, they need to consent to their learners that please provide the services to my child. So for today, we're strictly focusing on those learners who brought their consent form back.
Machinini adds that the contraceptive program is intended to curb teenage pregnancy. She says they shared information with all learners before administering the contraceptives the learners chose to have. Nurses also shared information on side effects and how they should be handled, stressing that not all young people are sexually active, but all need information.
With regard to the contraceptives, remember that their body is not used to this. And then sometimes it takes 6 to 8 months for the body to get used to this injectable and then the implant that we have inserted. We already informed them of the side effects. Some might experience the headache, and then we treat all these symptoms symptomatically.
Young people who attended said this initiative was good for them.
I received service from Free State Department of Health Mobile Clinic. The service I received was all about Implanon. The Implanon is something that we use to prevent pregnancy, and it helps a lot as teenagers to prevent from unwanted babies and unwanted pregnancy. The way it is inserted, they only insert it in your skin, and it stays for 3 years.
Yes, because we don't know about our health statuses, so that is why the Department of Health came here, so that we can come and check our health statuses and what we can do about them.
According to the Human Rights Commission, infringement of children's rights would only happen when there is coercion to get contraceptives.
Implanting this to minors or to learners at school without their consent would amount to a violation of their rights. It also borders, into a criminal, assault over their bodies. They must consent, and it must be voluntary. They must voluntarily consent to participation in this process. And the other thing is they need to be given, accurate information on the implications and the consequences of taking this implanted contraceptives.
The Soul City Institute also supports the rollout of the contraceptive initiative.
Soul City Institute, we do support the campaign which is the initiative of the National Department of Health, which is now running like in all the provinces regarding the fight against teenage pregnancy. Reason being that we are an intersectional feminist organization, so we believe in capacitating young women in order for them to can be able to reach their potential. So now teenage pregnancy is contributing a lot in terms of drop out from school, HIV infections and all that. So young people end up not being able to achieve their dreams.
The Health MEC Monyatso Mahlatsi says it's unacceptable that a 13-year-old gives birth. He told young boys to accept a no from a girl, adding that they would mess up their lives with a criminal record. Kamagele Siekwi, SABC News, Bloemfontein.